I'm Dr. Chris Roberts. I'm here with my nurse practitioner, Dr. Curtis Beall. We're going to talk a little bit today about hormone replacement therapy, but this time we're going to talk about men. Curtis, what can you tell us about hormone replacement therapy for guys right now?
Yeah, so that's a big topic, right? You see all the bodybuilders, you see all these physiques. Everybody wants to be on testosterone, and there's some good reasons for that. I think there's certainly times where it's not maybe appropriate or necessary, but it can have a huge impact for men. As we talked before, it can also help with women, but obviously testosterone's the major male sex hormone, and it has a lot of roles and functions, and so it's definitely something that can be life-changing for men.
So at Customized Relief, how are we different? I mean, how do we give testosterone replacement therapy or whatever form of testosterone support? How do we do that as compared to maybe other clinics?
So I think the first and foremost biggest difference is we test. In other clinics and other online providers, they will test, but we kind of tailor it, right? We don't have hey, we're going to put you on 200 milligrams a week. Good luck. We'll see you in a year. We really follow the testing, but we also tailor the dose. There's a wide range, as we know, with the reference ranges, but if you're between 300 and 1,000 on the reference range for total testosterone, you're normal. The problem with that is I can tell you for sure a guy that's at 300 does not feel the same as a guy that's at 100 or 1,000, excuse me. And then you dig into free testosterone, sex hormone binding globulin, other tests that we will do. The free testosterone probably being the most important, because you could have a guy 700 who has a free testosterone under 100 who doesn't feel near as good as somebody at 400 total that has a free testosterone of 150. And so
That's correct.
We really make sure to test and tailor the dosing to each person, and we follow that, right? We're not going to give up on you after a year, or after we do start you on testosterone. We'll follow it every 3-6 months to make sure that your levels are where they need to be.
Very good. And so again, in guys, if we had them come in, what would be some symptoms or signs that they would have that would make us think that they have low testosterone?
Yeah, so first and foremost, you think of, I have no libido, sex drive, it's in the toilet. That is one of the symptoms. I will tell you, however, that issues with sleep, fatigue, especially early morning fatigue, just feeling like I can't get out of bed, believe it or not, joint pains. The other thing that is interesting is moods, right? So depressive moods, anger sometimes. You kind of hear, if my testosterone's too high, I have anger issues, but it can be the opposite as well. When your testosterone is too low, that could be an issue. So those are some of the signs that we tend to look for, not just the sexual side effects, but some of those other fatigue and things like that, and muscle loss. So not being able to gain muscle, recovery after workouts, you're just not recovering as well as you had before. A wide range of symptoms.
So because we kind of talked a little bit about the different forms of replacement, can you go over that with us as well? Because again, there are some that are more popular. Again, you mentioned that a lot of people are just given the injectable that they can get from a regular pharmacy. What are some of the other options that we have for treatment?
Yeah, so far and away, injections are the most common. They make the most sense probably 1 to 2 times a week. However, not everyone wants to be poked, and we do have a lot of other options. Just as we do with females, creams is one. We don't do a lot of creams, I'll be honest, for a couple of reasons, and not to get into the weeds and super technical, but it tends to have a lot more effect on something called DHT and increasing your risk for hair loss. Troche, which we had discussed in the female video as well, but they're kind of these gel-based troche type. I guess the troche's the name, but you kind of put it between your gum and your lip and let it dissolve. And the last one, and kind of an interesting, kind of an exciting one, is a liposomal form. And this one is bypasses the liver, so it's a chewable liposomal tablet that you kind of chew and swallow, and doesn't have some of the effects that an oral testosterone would tend to have with the liver. And then there's other methods that aren't testosterone specifically, but they work to boost testosterone. So whether that's supplements or SERMs is what they're known as, enclomiphene and clomiphene, which basically trick the body into boosting testosterone kind of naturally. And then from a supplement standpoint, there's a lot of different testosterone booster supplements, and you're talking about things like Fedoja, Tonkat,
Mm-hmm.
Ali,
Mm-hmm.
Maca, believe it or not, can actually help. So those are the different realms of therapies that we could offer.
So again, even with guys, we like to do testing. You mentioned the free testosterone. Even guys, though, will probably get some benefit out of some of the urine metabolite testing too. Again, what we want you to know is that at Customized Relief, we want to personalize the approach for you. It's not a one-size-fits-all. And again, we look forward to seeing you and answering any questions that you might have.